This needs assessment was based on sex workers and their healthcare needs. The red umbrella is seen throughout this project. It is a symbol within the sex worker community that shows unity. Red is typically thought to be the color of love, and an umbrella shows protection. The purpose was to better understand the healthcare needs of sex workers in the Denver metro area. While there are no concrete number of commercial sex workers, the sex industry in Denver yields profits of up to $39.9 million annually, and also to gain greater insight to the barriers present for this population with specific regard to their healthcare needs. Data collection. Data was made available through 2 local agencies. The Sex Worker Outreach Project, which has a local Denver chapter. This organization offers resource referrals to anyone engaged in commercial sex work. And Streets Hope, another Denver-based agency that offers therapy and case management for sex workers. They are currently involved in street-based outreach as well. Interviews were reviewed and qualitative data was withdrawn to establish common threads. Key findings. Samples of questions asked included, when we consider that most sex workers are self-employed, where do you think they are accessing health care? And what do you believe is the biggest healthcare concern for sex workers? The 2 biggest healthcare concerns were STDs and STIs and mental health, period. All of it. Where they are accessing physical health care, if they are fortunate enough to have private insurance, they're accessing health care with a primary care physician. The representative from SWAP said that there were some strip clubs that offered insurance locally, but that is definitely not the norm. Low-cost community clinics. This could be offered as a sliding scale based on what you can afford, and free local clinics. This would be an option for anybody. It was found that some sex workers are using either Medicaid or Medicare also to fund their healthcare needs. Access to mental health care. Unfortunately, for the most part, you must have your own insurance to seek mental health professionals. There are some agencies that offer health care on a sliding, no-cost, low-cost scale, but not very many. And there is a considerable amount of bias in that mental health care. The barriers to physical health care. There's an intense stigma revolving around the work that sex workers engage in. And unfortunately, they're faced with moralistic judgment instead of ethical practices upon receiving care. There's discomfort around having to disclose personal information that can be viewed negatively. This could be the number of partners that they've had, the number of pregnancies that they've had, the number of STDs or STIs that they've had. And due to these stigmatizations, there's an increased chance that sex workers won't seek care, thus increasing chance of STDs and STIs, which could have long-term negative health consequences. Also, some sex workers are worried about mandatory reporting procedures and it intersecting with private life, especially for those with children. There is some concern that if it is found that they are engaged in sex work, that DCF will get involved, and there is a potential that their children will be taken from them. And mental health care. In Denver, there are not enough options for affordable, low or no-cost mental health. That applies to everybody. There are really only a handful of agencies that offer those services with low fee. And even if you're fortunate enough to find a healthcare provider for mental health, there are very limited resources that deal specifically with sex workers. And unfortunately, there's bias in mental health in regards to sex workers, primarily their entry into sex work being founded exclusively in trauma. While that can be the case, having a practitioner with those biases will not foster authentic communication about current needs. For example, boundaries, self-care, relationships, the strain of daily stigma, and allocating time for resource development to navigate legal and social welfare systems. There is pervasive societal and professional stigma that creates internal barriers of sex workers to even reach out for medical or mental health care. So recommendations. How can we do better? Continuing education surrounding the difference between sex work and trafficking. When researching locations, there were a myriad of choices for trafficked victims, which is fantastic, however, not so many for sex work. And sometimes they're used interchangeably, and they're not. They're two different things. Sex work is a choice and trafficking is not. Consider specific training for both mental and physical health care professionals. There has been some research in gynecological journals that is showing that there is a trend moving towards doing paper disclosure instead of in-person disclosure, which is getting pretty good results to get honest, authentic health records from women. And I think that they should really move that way. And as far as mental health providers, they really need to check their bias at the door. That has no place in the therapeutic process. And we need to make sure that we are seeing these men and women for the reasons they've come in the building, not the reasons that we assume that they've come in the building. We need to generalize a harm reduction philosophy to include sex workers. Harm reduction has been used for IV drug users for some time now, and it is now being used for sex workers. There's been some positive results in Brazil and Thailand in regards to harm reduction philosophy used to decrease STDs and STIs and unwanted pregnancies. I think that should be generalized to the United States as well. I think it could do a lot of good. Encourage organizations such as SWAP and the Red Umbrella Fund. Those are founded by sex workers, for sex workers, with sex workers in mind at the forefront of those conversations, and that's important. Establish other support networks. Those could be in-person meetings, or they can be social networks on Facebook or Instagram or Snapchat, where there's conversations about the work that they do, what Dr. Scholl's they should use in their shoes, what kind of tampons they use, what kind of lube that they use, and normalizing that conversation to include them so that that internal stigmatization isn't happening. And a very common thread was decriminalize. There has been some positive effect overseas and in Nevada as far as decriminalization is concerned, and I think that is our next best step to help these women and men through this process, because this is the work that they've chosen to do. This project will be made available to both agencies through either an external link, or I will email them directly. Reflection. Successful. I enjoy research. The organizations that I worked with were excited and very forthcoming with knowledge. They have really great information, and I was very appreciative of their time. Some hindrances. The third party that I tried to contact never responded to my emails. Like I said, there's only a handful of agencies here that work with sex workers primarily, and to have a third of them decline or not respond was a tricky situation to navigate. And this was my first needs assessment. So with all new skills, this will have to be honed as well. And the information wasn't entirely new to me. I've done some research on sex work before, so this was a little bit of a refresher for me. And I should have really widened my scope to try to obtain more information about the population. I should have kind of sought out those trafficked agencies to see sex workers and see what they're doing in those populations as well. And from my experience, I learned that there's a significant gap in care for sex workers, that mental health is a huge problem that no one's willing to address, and physical health is a significant problem as well. However, I was really excited to see that there is an emerging trend that seeks to develop more harm reduction strategies for sex workers, primarily those involved in street-based survival sex trade. And then these are my resources. Thank you to Alice Meyer of Street Soap and Billy McIntyre of SWAP. Thank you.